Hey everyone, Michelle here, personal trainer and lifestyle coach. Today we are here talking with Moisés Salgado, who is a graduate student and an athletic trainer at New Mexico State University. He works with our team and also with baseball. Thank you so much for being here, Moisés.
Yeah, thank you for having me, Michelle. I'm excited.
Me too. So, I kind of wanted to talk about, I like to bring on different types of health and fitness professionals on here so that we can get an idea of just an over encompassing piece of, healthcare, making sure that we're taking care of ourselves, making sure that we know what we're getting into. So, I thought athletic training would be a really interesting subject to get into a little bit more. Now, obviously, athletic training is not exclusively for athletes, but most of our conversation will be a little bit about athletes. So, can you tell us how you got where you are today?
I've been a certified athletic trainer only since this past July or August. But I've been practicing athletic training and studying it since my second semester of freshman year of undergrad, which was in 2019. So it's been a little bit, still relatively very new to the game. But I went to undergrad at the University of Michigan, where they allow you to start your clinical rotations with sports teams earlier than a lot of other athletic training programs. So I actually got to start my clinical experiences as a first semester sophomore, and most programs don't start till like junior year. So I've been lucky enough to work with almost a dozen different athletic teams throughout these past 3.5 years, or 3 years, 4 years, something like that. So I started with Michigan men's lacrosse. Then I went and I was with swim and dive and water polo during the COVID semester. So that one got cut pretty short. I only got to work with them for about a month and a half. And then from there, I went to track field and cross country. From there, I went to softball and then to men's basketball and men's golf. And finally to football, where again, it was a kind of a short semester for me because they were trying to get me to a high school because it's normally required for an athletic trainer in a bachelor's program to spend at least one semester in a high school. But because of COVID, the accreditation program kind of cut it, the requirement. So I didn't end up having to do that. So I spent all my time in collegiate athletics. And then I also did an internship in the summer of 2021 when I was working with a baseball team. And then, yeah, now I'm here and I work with New Mexico State baseball and cheer. But I've also had the chance to work with men's basketball and women's soccer while I've been here, and football pretty extensively. And then I also covered one volleyball practice. So that was cool too. So
Awesome.
that's a
So,
little
you
bit
get
on
a lot of
my,
variety.
yeah. So I've
Yeah.
worked with a lot of different sports.
Awesome. Now, are you from Michigan originally?
No, I'm actually from Chicago. I was born and raised in Chicago, went to middle school, high school there, and then when I graduated high school, I started at the University of Michigan in 2018. And then I went through 4 years there, and then I came right here after just graduating this past April.
Awesome. And then, did you play sports? I'm guessing you did, but what kind of sports did you play growing up?
Um, the first sport I ever played, I guess, like organized, was soccer. Not super far from my house in Chicago. I played soccer for I think 3-ish years. I played a couple outdoor seasons, a couple indoor seasons as well, because in Chicago it gets cold to the point where you can't really have an outdoor season in the winter. Um, so I started with soccer, and then eventually I got a little bit bored. I wasn't great at soccer, but I did have fun just running around and making friends. And then I wanted to try something new, and my dad was really pushing for football, but my mom didn't know if she wanted me to get into anything like so contact heavy. So I ended up playing baseball just for one summer. Um, I liked the people I played with, but I did not like baseball at all. It's not my personal sport. I don't think I have the hand-eye coordination for it as much. But then luckily, not too long after that, I was like, well, I need something else to do. So I enrolled in some like flag football program at the neighborhood park. And I really love that. I played flag football for like 2 or 3 winter seasons. And then eventually my mom warmed up to the idea of playing football. And I ended up playing football from age 10 to 18. And I played, and then not too long after that, I started playing basketball. And basketball, I played from like 12-ish to 17. So a few years of basketball and football were my primary two sports, and those were the two I played in high school. Yeah.
Awesome. So it probably helps that you've played a bunch of different sports, working with different sports now, right? Like just having that experience in the background.
Yeah, definitely. I think it definitely comes into play more with football and basketball than it does with baseball and soccer. Even though I feel like I have a good understanding of how all four of those sports work, um, I would say that I can't like remember how, especially as like a 7 to 9 year old playing those two sports, like I don't remember how my body felt and all that. So it's not as helpful as it is with football and basketball, which are a little more fresh and more like stuck more with me.
That makes sense.
But yeah, it definitely is a help for
Cool.
sure. And just having played sports in general and also having like worked out while I was in high school preparing for football too, I feel like that helps me understand sometimes to a certain extent where my athletes are coming from.
Very cool. So then what caused you to want to get into specifically athletic training?
Yeah, so like a lot of athletic trainers, I got injured, pretty significant injury, had to do months-long rehab process for a torn ACL during my senior season of football at Walter Payton College Prep in Chicago. So I injured it, or I tore my ACL, I think in like week 8 or something. And in high school football, there's about 10 to 12 games, depending on the playoffs. So it really sucked because it was like only 2 weeks before the playoffs started, and I tore my ACL. So it was pretty sad, especially I was having a really good season. But then I started doing rehabilitation at ATI physical therapy. That was an office not too far from my school, and the athletic trainer at my high school was contracted through ATI. So she kind of connected me with them, and luckily my insurance was able to pay for it. So I would go about 3 or 4 times a week for like 3 months, and then it started like kind of going down in sessions per week. But when I would work with the athletic trainer at ATI as well as the athletic trainer that we had at school, they were just really helping me build up and like build my confidence back in my knee, build my strength in the muscles surrounding my knee, and just like I really grew to appreciate what athletic trainers do through that experience. I was already somewhat interested. I honestly, going into senior year of high school, didn't know what I wanted to major in college. I was kind of like, yeah, sports medicine seems kind of cool, and kind of also juggling like 2 or 3 other things that I was interested in, but nothing I was really, really passionate about until I had this experience with these two athletic trainers that I would work with so often for this 4 month stretch. And I was like, this is what I want to do. Like, I want to help people get better physically and mentally. And another aspect of this was like, to me, it's really important that as a Latino man that I'm in this profession because it's a demographic that's severely underrepresented. Um, I think as of like 2019, the National Athletic Trainers Association was about 80% white. And when you think about athlete demographics at I feel like any level, it's probably not 80% white. So it's definitely something that matters to me to be in this position because when I was growing up, uh, first of all, when I was growing up, there was no athletic trainers until I got to high school. There are kids now that have athletic trainers at their like private football and basketball leagues and stuff, but that was never the case for me until I got to high school and my school had an athletic trainer. And even then, the athletic trainers that I personally had throughout my 4 years were all white, and every athletic trainer I saw on an opposing team sideline was usually white as well. So I think it's important for especially people that look like me, young men of color, to see me in a role and see me on the sideline and be like, well, he's not a player or a coach. What could this person be doing? And that just kind of opens a door for a new possibility for us to be involved in sports and not necessarily have to be coach or player.
I love that. That's a really great point. And do you see a transition of that? Are you seeing more people of color in the athletic training fields?
Um, it's a little hard to judge just because I've only been at two places extensively, at Michigan and here. But to be honest with you, while I was at Michigan, that definitely was not the case. I was so in the whole athletic training program at Michigan at its biggest while I was there was about 43-ish people. And I was one of, I think, 6 or 7 people of color in that whole group. Um, and then here at NMSU, it's actually pretty cool because the majority of the students are students of color, so it's a really uh, big difference for me. And it's a welcome difference for sure. And it's refreshing to see people that, like I said, people that look like me also studying this. So I haven't like looked at the numbers more recently, like 2021 or 2022 statistics, but I did do a research inquiry for class about this and about athletic training, uh, people of color representation in athletic training a while back. And based on those numbers, it was not looking so great, but
Yeah.
I don't know how it's progressed since then,
Okay. I remember
just
hearing
from my
similar stats
experience.
about like the NFL and head coaches, you know.
Yeah,
Yeah. Yeah.
definitely.
Okay. All right. Thank you for sharing that. I think that's a really great point.
Absolutely.
So let's talk a little bit more about your role within sports. You mentioned that you have a bunch of different sports that you've worked with. What's been your favorite population so far?
Oh, okay. Um, So I would say the collegiate athlete population would have to be my favorite, just because, as I told you before, I never got the chance to work at a high school during my rotation. And in addition to that, there's usually also some sort of physical therapy component, at least in Michigan's program, where somebody would spend like 8 weeks at a high school and 4 weeks at a physical therapy clinic throughout the semester. And like I said, because of COVID, I never got that semester, so I didn't work. I've never worked at a physical therapy clinic, which honestly, that's not my personal interest to work inside an office like that, so I'm kind of okay with it. And then I never got the chance to work with a high school for an extended period of time, but luckily during that internship I did in the summer of 2021, I did have 2 or 3 weeks where high school athletes came to our campus and we treated them while they were there and they kind of like stayed overnight for 4 or 5 days. So it was like I got to work with different high schools and different high schoolers. So that was pretty cool. But I would still say that the collegiate athlete population is probably my favorite. I've been working with them for almost the entire time that I've been doing athletic training.
Very cool. And is there an ideal population you'd like to potentially end up with?
Um, yeah, I think that I wouldn't be opposed to any particular population of people, but as of right now, I do see myself staying, or at least ending up in the collegiate level or professional level of. I'm not 100% set on it, but hopefully in basketball, that's what I'm going for right now.
Okay. And why basketball?
I would say basketball is my favorite sport so far that I've been an athletic trainer for. Um, I was doing it as a student at Michigan for those 3 or 4 months, and I also did it here for just a week. And it was really cool because basketball is one of my favorite sports to watch, along with football. But football athletic training can be a lot because there's so many people and it's so heavy contact that like there's gonna be injuries every practice type thing. In basketball, it's a little less likely, I feel like. So it's a little more chill. I also like never really get bored of basketball, like watching it, and a lot of athletic trainer's role, at least during practice, is just like being there just in case anything happens. So ideally, I want to be at a sport where I actually like what I'm just sitting there watching for 3 hours a day. um, and then also the last part's just like the injuries that come up with basketball. I think are varied a lot. They can be small things like cuts and bruises, scrapes, stuff like that, obviously, but then it can go all the way into very explosive injuries that come from jumping or landing, or even that small contact component that it is in basketball too.
So I don't know if I told you this or not, but I used to cheer. I was on the stunt team for the Portland Trail Blazers for NBA, and I was
Oh,
there
okay.
the
No, I
day
didn't.
that Nurkic snapped his shin in half. Oh my gosh, it
Oh,
was so nasty. It was crazy. You could
man.
literally hear it. Like, so have you had anything extreme like that? Like a big concussion,
Oh,
big bone break, anything like
um,
that?
the closest to that kind of injury that I've personally seen would definitely be a dislocated ankle. Luckily it was still a closed wound. It didn't come out or anything like that, but it was a graphic sight to see for sure. But luckily they were able to place it back in within I think like 2 or 3 minutes.
Is that
Um,
your role? Do you or the doctors?
it
Okay.
was it was athletic trainers that did it,
Ah, okay.
but it was the head athletic trainer of Michigan football. Um, not me, not me as a 21-year-old with oh man, I would not handle that well. Maybe now I'd be more prepared for it, but at that time I was not ready for that.
Okay, so that actually brings up a really great point. As an athletic trainer, you have to have a little bit of an iron stomach, right, for some of the stuff that you're going to see. How do you
Yeah.
deal with that, and how do other athletic trainers deal with a little more gruesome injuries?
Yeah, I think it definitely varies for everyone. That even sometimes is that even sometimes is the reason that people want to or don't want to get into certain sports because they don't want to see such gruesome injuries that have happened and can happen. But I would say it's mostly about experience with it. Like I said, that's the most gruesome thing that I've personally experienced. But we're also like, at least in my education at Michigan, it was like almost every body part that we reviewed possible injuries for, we reviewed pretty gnarly injuries that could happen. So everyone like is aware, and I think that already kind of starts to build up some sort of iron stomach or even like uh I don't know, iron brain type
Yeah.
of type of situation. But I would say that it's really about what you already have experienced. So like I'll give a brief example that isn't, I wouldn't say as much gruesome or gnarly injury, but more so like a scary situation, like an emergency situation. So uh at one clinical rotation I was at, there was an athlete that went through a seizure during practice, and this was pretty early on in my career as a student, and I kind of just like froze. And when I was told to go get a certain bag or something like that, like I took a long time to get it, and like luckily this person ended up being okay within a few minutes, and everything ended up fine. But I kind of just like was frazzled, and I didn't know what to do. And then at a clinical rotation, maybe like a year or so after that, uh, another athlete from that team I was with had a seizure during practice, and I was able to respond a lot quicker and a lot more efficiently and like correctly, I guess, you know. So um, I think it's a lot about the experience with it too, than it is about like seeing it on a computer is really different than actually like having to be in that like high adrenaline mode.
So do you feel like there's a piece of almost desensitization there?
Yeah, I think there has to be because if you see something and your first, well, I feel like anyone's first thought would be like, "Oh shit," but um, I think if you see something and you're kind of like thinking through, oh my gosh, what is this? Why is this happening?" type thing, instead of like respond, then you're only hurting your athletes. So it's kind of got to be just like, all right, what do I see? let me go from there. If I see a lot of blood, like I know that's the first thing I'm gonna handle. So let me just get as much gauze as I can and get my gloves on, you know?
Definitely. Okay. So now that we're talking a little bit more about what you do as an athletic trainer, we've, talked about emergency situations, injuries. What would you say that your main roles are as a trainer?
I think that athletic trainers take on a lot of different roles. I think the main one that's usually associated with it would be similar to a physical therapist in terms of helping to modulate pain, modulate swelling, and working through getting stronger and coming back from an injury. That's probably I assume is the most common thing associated with athletic training. But there's actually 5 domains of athletic training, which include that, which is therapeutic intervention. Uh, it also includes, let me think, this was on my certification test. Um, there's also a like administrative domain, which is like all the paperwork that goes into referring someone to the doctor, all the paperwork that goes into um, going to get tested for COVID or going to get like a sickle cell test. All that is stuff that we do and we, I guess, process and file, storing all these medical records that have to be stored for a certain amount of time, depending on what level you're at. All that goes into it too, making sure that we're documenting treatments and injuries and progressions because there's also that like legal component that eventually could factor in. So you just have to have everything well documented. And then, as I was just talking about, there's like immediate and emergency care. Um, so, like in the examples I was just talking about, somebody goes down in practice with a seizure, you're the first person there to respond. Same thing with like any sort of CPR, AED, or like any situation where the ambulance has to come. We would be in charge of that too, like calling the ambulance. So, yeah, those are 3 of them. I'll see if I can remember the other 2 while we're talking.
Okay, definitely. So I know that there are different settings that you're in. You mentioned being at practice, being at games. So what are the different settings that you usually treat athletes in, and how are those different for you?
Yeah, so my typical day kind of looks like I have a certain amount of time for cheer in the mornings or early afternoon. And usually that is a rehab slash treatment only time. So that'll be for anyone that has a pre-existing injury, they'll come in, we'll do some sort of rehab plan that I have written out. Or sometimes it can also be an evaluation type deal during that time, which is another domain of athletic training. So it would be like an athlete comes in and they're like, yesterday this happened at practice. And then we go from there trying to come up with a differential diagnosis type thing. So it could look like that. And that's my routine with cheer, like I said, in the late mornings, early afternoons. Then I come to baseball anywhere from 2 hours to like an hour before practice, depending. And usually then I'm doing like a pre-game or pre-practice setup with which is just like bring out the waters basically and like bring out the emergency equipment that we need in the dugout in case. Um, and then it's like pre-practice treatment. So people come in, uh, say, hey, my quads are really tight from those squats we did this morning. Can we do some stretching for it? Or can we do some massage? Or my hip flexor is really hurting. Can we get some stim on it to kind of numb this pain a little more before I go out there? Or even something as simple as like a heat pack just to loosen up. Yeah, so that's how it would look before. And then after some sort of practice or game, or I guess during, I'm like available and ready for the emergency action part or the clinical eval part. Like it could be a non emergency that I still need to evaluate, right? So that's kind of what it is during. And then we get to the end of practice, and ideally, obviously, nothing's up, like everyone's okay. End of practice, and then people just come in for more treatment. And this will be more like recovery treatment. So, stim is still part of it, heat can be part of it, ice is like the main thing for a lot of people in terms of recovery, that or ice bath, ice cup, different forms that you could do that with. So, yeah.
And I've heard people come in both pre and post game and or practice. So are there certain treatments that you either recommend or generally have athletes ask for, like pre versus post? And is it
Mm.
different practice versus game?
Yeah, so ice slash like game ready, which is like just basically a machine with ice and water in it that uh does a good job of doing like ice with compression on whatever body part is needed or whatever joint is needed. So that is something that I would usually only do after, unless it's an athlete that isn't practicing that day because of their injury or whatever it may be. Then I'm like, okay, it doesn't really matter what time you do this, or even if we start earlier, you can do it multiple times before practice is over. But like if somebody came in and was like, "Oh, my shoulder hurts," like I wouldn't put an ice bag on their shoulder 20 minutes before practice starts, because that's just gonna stiffen them up and not let them be as loose. So usually stretching is always something I want to do before, unless it's they tightened up during practice, then we would handle it after type thing. Um, but in terms of it's really just about heat and cold, I think, in this situation, or at least that's all that comes to mind immediately for stuff that I would definitely do before and not after, or vice versa.
Okay, and there is obviously always changing research about heat and ice. And one of the things that I've seen more recently, you can let me know if you have as well, is the preponderance toward ice is a little bit stronger now and a little less toward heat, just depending, of course, on the situation. So
Mm,
the old adage was rice, right? Rest, ice, compression, and elevation. Do you feel
mm.
like that is still applicable, or are there other better ways to deal with things?
Yeah, so I think I remember learning that the RICE acronym is now changed a little to rest, immobilize, cold, and elevation, which honestly, the only difference there is really just the immobilization instead of compression. And I feel like that was often the case anyway. Like if you were compressing it, you were also immobilizing it ideally. And like in a game ready, you kind of are too. Like the athletes aren't moving those joints while they're in those sleeves. Um, so it has changed a little in that. And then um can you repeat the question again? I'm sorry.
Basically just if you still think that the rice acronym or the new variations are still applicable, or if you think that there are,
Oh,
more toward the ice, a little less toward the heat, or how that's forming right now.
Um, I I would say that in my experience, my athletes respond well to that and like it. They feel better after they ice after they get through all four of those in the RICE acronym. In terms of difference between heat and cold, it's generally good to avoid heat within the first 2 days of an acute injury, just because heat can bring more swelling to an area which would probably increase pain, and then from there, decrease range of motion, decrease strength. So we obviously wouldn't want that. So in terms of acute injury, it's always ice over heat. But eventually, after a few days, like that kind of won't matter anymore. And heat can also modulate pain. So then from there on, it could be even sometimes like let's do contrast, let's do both, like back and forth, or just one or the other, depending on what somebody prefers.
Okay, definitely. And it sounds like there's a pretty consistent element of trying to reduce inflammation. I wasn't planning on asking this, but I think it's a really important question. Is inflammation is your body's response, right? So it's there for a reason. So how do you feel about allowing inflammation to happen versus trying to reduce it?
Right. Yeah. I mean, inflammation is definitely necessary because if there wasn't inflammation, then you would just keep on going as if nothing's wrong and continue to damage that body structure. So it's definitely something needed and like important, and obviously that's why our bodies do it. Um, but when it comes to sport activity, inflammation would be a big hindrance to return to play if we just kind of let it happen as it naturally happens. maybe in a different population like we talked about earlier, you can kind of just be like, if you have the flexibility with work or with school or whatever you're involved with, if you have that flexibility, just stay home and rest, immobilize, cold, and elevate. You know what I mean? And then just like let it take its time in that process, and maybe we don't even have to fight it that much type thing. But when it comes to, I have this athlete who just twisted their ankle and they have to play a game in 5 days. Like, we can't let that whole inflammation process play out.
That's a really interesting point. I hadn't thought about the different populations. So obviously, it sounds like it would be better if you could rest to actually allow this whole process to occur a little bit more naturally.
Yeah.
But it's more rushed almost, would you say, in athletes?
I would definitely say it's a little more, it's trying to rush the process, definitely. Or just like stop it at after a certain like healing point, I guess.
Okay, cool. That's a good way to think about it. Now, you did touch on this briefly, but can you elaborate a little bit more? Let's say that someone gets injured, something minor like a sprain. What would their general timeline look like? How quickly should they try to go see a specialist? And
Mm,
what are some basic care items that they should take care of?
got you. So I think we're talking about a like a lateral ankle sprain type
Mhm.
thing. Yeah. So like a mild lateral ankle sprain is something that is gonna happen a lot, especially in sports where you're getting off of the ground. It's just like, I'm sure that the majority of people at some point in their lives have a lateral ankle sprain. And it happens because the ligaments down there are not too strong compared to your entire body weight that may be landing on an ankle and forcing it that way. Like, that ligament's not stopping that. So it's gonna happen every now and then. I would say that the process that goes into it, timeline wise, it varies per person, obviously. It can all vary on, let's say, let's say that it happened at a practice last night and there was no AT coverage for it. And this person just went the whole night, like, didn't ice, didn't take medicine, didn't do anything. They're gonna come in and their ankle's gonna be really, really swollen. So we're kind of like, in a sense, already behind the eight ball with that. So that one might take a little longer, as opposed to, I'm at practice, something happened, lateral ankle sprain. I take them up right away and have them get it in cold and do some like cryokinetic activities, to kind of not even, well, more just like delay that inflammatory process and like kind of subdue it. And then they come in the next day and their swelling is very minimal, even if their pain is pretty high, like in that area and the tenderness and all that.
Okay, so are there
So
some of those things that people could do? Maybe they can't see you right away, could do on their own in order to best help you when they do get to come in?
yeah, I would definitely say that the RICE acronym comes into play in that situation. Like, ideally, if someone had an ankle sprain and I couldn't see them till the next day, that's exactly what I would want them to do. Stay off your feet, get some ice on it, elevate it higher than your heart so that the blood is like coming back toward your heart, and not going toward that extremity, especially at the like lateral ankle is really far away. So once it gets there, it's harder to like bring it back, if that makes sense.
Definitely. And it sounds like the sooner you get to it, the sooner you can take care of it. Typically, does that help in recovery time as well?
Yeah, definitely. Because like I said, like we've been talking about with this inflammatory process, like, it's because of that that we even end up having a lot of pain, because like the inflammatory process sends pain chemicals out. Um, so it's because of that that we even have the pain, and then because of all that fluid buildup, that would be the decrease in range of motion. Like, it's not like because you maybe tore a ligament in your ankle that now you like can't move your ankle. You know what I mean? It's because of that fluid that kind of limits how far you can go.
Okay. So now let's say the next day or same day, hopefully, an athlete comes in. Let's talk a little bit about assessment. How do you assess athletes? How do you know what to do with them? And how did you learn this school versus, what you've actually experienced?
Yeah, so I would say that the majority of athletic training programs are similar in terms of curriculum, and that's because of this big, I think I mentioned earlier, this accreditation institution, I guess, called CAATE, CAATE. It's like in charge of setting the standards that all athletic training education programs have to kind of implement. And so when we're talking about, I think most athletic training programs are going to have some sort of lower extremity evaluation course. So that's where I learned the majority of like, okay, so this person comes in and they're complaining about this. Your thought process is, all right, let's test range of motion. What's the history behind this? Have you ever injured this body part before? Because that's like the most common predictor of re-injury, or of injury, I guess, in general, is having a history of the same one. So it's history, range of motion, objective things like, um, can I see that their ankle is swollen? Can I see that their ankle is bruised and different color? Or um, even if it's something more, I guess, graphic than that, like, can I see the dislocation or the like bone, like the physical bone, like fractured or anything like that? Right. So that all goes into evaluation. And then there's something called special tests, which are just like, I think for different joints, there's a lot of different special tests. For the ankle, I think there's maybe 6 or 7, and then you get to the shoulder, and there's like more than 15 at the shoulder, just because it can do so much, right? So we learned that all in those evaluation classes, and then continue to practice those during our clinical experiences. And I feel like it was more so at clinical that I got to watch certified athletic trainers perform these tests and like do it more efficiently, because we as students will learn it in this big and all-encompassing manner. So I'll keep coming back to lateral ankle sprain because I feel like it's a pretty common injury. But when someone comes in with a lateral ankle sprain, tells you all the mechanism lines up perfectly with lateral ankle sprain. They've sprained this ankle before. You can see that it's swollen on the lateral side, not the medial side. Like, you don't need to go through the entire ankle evaluation like we are taught to, because there are some special tests, there are some strength tests, there are like history that it doesn't really, not that it doesn't matter, but it's like it's not as relevant. And if we want to do this a little more efficiently, like there's no need to go through that, because none of what you're saying lines up with like me needing to do this test, I think.
So you start to kind of learn shortcuts almost based on
Exactly.
prior experience. Okay, cool.
Mhm.
Awesome. So now that you have assessed an athlete, we kind of talked about the acute injury piece and making sure that we're icing, compressing, all of that. What happens after the initial treatment? How does the injury usually progress?
Yeah, so usually they'll come in first time, maybe first 2 times they come in, it's like treatment specific, only treatment. We're not gonna, like, somebody coming in having just injured themselves last night, I'm not gonna have them do rehab and strength training the next day. I'm gonna give them time to rest. Maybe the third or fourth day they come in is when we'll start. Okay, let's start with some open chain activity, which means like not weight bearing or not, um, I guess, like free. Like my hand is free right now, but if I put it on the table, it'd be like a closed chain thing. Same thing with my feet. Like I'll have an athlete on the table and they're just like have a band and they're doing ankle pumps, right? That's an open chained activity. Or even like marble pickups would also be a kind of more simple and open chain activity. So we get into that, then progress through those. As long as everything's going well, we'd advance to something more like, okay, double leg weight bearing, like calf raises, exercises such as that. Then we move on to eventually, this is probably after like more than a week, maybe even more than 2 weeks, we start getting into like, okay, let's get off the ground. Let's do like little hops down this line. Let's do zigzag hops down and across this line. Or like let's balance on a foam pad for 30 seconds at a time and make those small intrinsic muscles work. So that it more so becomes like a retraining of your muscles and I guess also nerves, ligaments, all that to work together to prevent this from happening again.
Okay, so you kind of talked about both establishing range of motion again with those open chains and then starting to work a little bit more of the strength and stabilization. Is that how you would say the timeline generally goes?
Yeah, definitely. And then eventually it also, I forgot to mention, it also becomes sport specific activity when we're talking about the athletic population. So like for me with baseball, um, eventually I would mount up to, okay, let's go outside and field. Like I'll throw you some balls and you have to field the ground ball and pretend to throw to first, right? Because we could do balancing on a foam pad all day. I can have you do like these monster walks with a band around your ankles. And even if you're great at that, that doesn't mean that you can go out and like field a crazy ground ball that's going like, I don't know, 80 miles an hour over here, and you have to like run, turn your whole torso, and throw it to first base, right?
Definitely. So transitioning back into sport, how much of that is, and obviously this has to do with your familiarity of the sports as well, but how much of that is you saying, do this, not that, and how much of it is the athlete just
Mm.
feeling out what they can do?
I would say it depends on the injury. There can be some injuries that are a little more mild and more, uh, it would depend more on their pain. Obviously, I can't feel their pain. So again, I'll keep coming back to it, but like for a mild lateral ankle sprain, after a certain amount of time, like I'll let them go out and go ahead and I won't limit them. But I will say like monitor yourself, be smart, and like if you can feel it bothering you again, let's not risk it. Just either don't do that activity or stop for today's practice and let's just do some rehab. Um, so it can be based on the pain of the athlete for sure. But then in more serious situations, I'll have to limit them and say, okay, today we're not going to field. We'll only do batting. Or for cheer, like, all right, today tumbling is a no go because your wrist is in really bad shape, type thing.
Okay. And then during this time, while you're continuing to rehab an injury, are you still using some of those modalities like the stem and game ready?
Yeah, definitely. A lot of them are for pain mod, so like ice, stim, ultrasound. Um, Even there's something called Hivamat, which is pretty good at like getting swelling out. That I use pretty often on any joint that might be taking a little longer for that inflammation process to kind of just speed it up, like kind of a catalyst for that, I guess. And then eventually pain goes away because of that, like we've been talking about.
I
So
have
those
not heard of
modalities
Hivamat before. Can you tell me a
is
little bit more
it's
about
the
that?
one it's the one in the corner of the Fulton athletic training room that if you ever see somebody like they'll put on gloves, then they stick like one thing to them and then the athlete's holding the other piece, and then you kind of create this like I don't know, I'm not an engineer, but you create like this circuit or something of like the electricity in your body, and then when you start touching on them, you put like baby powder and it starts to vibrate. So you're kind of getting like a vibrating massage to try to get that fluid out.
That's
Yeah, I think it's pretty useful. It works really well on like swelling that is taking a while to go away.
okay. And then would you say that you have a favorite modality technique that you like to use?
Um, I'll kind of flip that and say I like whatever the athlete likes. So if the athlete thinks that cupping makes their back feel tremendous for a whole week, then that's what I'm gonna do. I'm gonna like I want them to feel good, so I'm gonna put the cups on their back. Unless it's something like contraindicated that I wouldn't want to increase blood flow to the back right now or to their muscles because of such and such reason. But as long as it's not contraindicated and as long as like I don't think it will hurt, for the most part, I'll let the athletes get the treatment they want because they know themselves better than I do.
Okay. So, one thing that you mentioned when we first talked about this subject that I thought was really interesting, I'd like to delve into a little bit, is the mental aspect of injury,
Mm.
especially something that is a little bit more chronic and takes a little bit longer. So, you had mentioned that you kind of got some assistance from some of your athletic trainers on the mental aspect, and that you like to help your athletes. So, can you tell me more about that experience?
Yeah, definitely. So as a senior, having played football for nine seasons, 9 years of my life, and I think in those 9 years of playing, I did tear my labrum once, but it was in a playoff game that we were losing by a lot. So like the season was over at that point, and I was able to recover in time for the next season to start. And aside from that, I never had any injury that kept me out for more than a game. So to get this ACL injury, and what was even sadder is like when I went to the hospital originally, um, the doctor thought it was an MCL thing, which is a little easier of a return to play. So in my head, that whole like night slash next day, I'm thinking like, okay, this is okay. Like I'll be out 3 weeks, and then all I need them to do is win one game, one playoff game, so that I can play in the next one. Um, but then when I came and they reviewed the MRI, my ACL was torn, my meniscus was partially torn, and my PCL was completely obliterated. So it was like a pretty significant knee injury. So to go kind of on that, I guess, kind of roller coaster, was it was hard, especially as a 17-year-old kid, having up to that point my best season of football in high school for sure. um, Playing a new position that I liked a lot, and it was hard to process that and like just kind of accept the fact that I knew I wasn't, even before this injury, I wasn't good enough to go on and play at a collegiate level. I really love football, and I think I was like a pretty good player, but by no means was I a D1 like college athlete. Um, so I knew before that season had started that I was going to be done after this year. So for that 12 games to turn into 8, or I guess really it was like 7 and a quarter, but to turn into that, it was hard to deal with that. And then it also took me out for basketball season, which also kind of sucked, because I enjoyed playing basketball a lot too. So yeah, it was something that I had to think about a lot, and like had to find the motivation to get better, because it was like, well, if I'm not going to play football and basketball again, like why do I even need to get back into shape? You know what I mean? Like I can just like I'll get into shape in terms of like for everyday life, but like why do I need to put in all this work as if I'm coming back to play football when I'm not? And it was athletic trainers. It was that athletic trainer that worked at my school, along with the one that I would go see at ATI a few times a week, that they would ask me, how are you doing? And it was always, yeah, how is your knee? Like, how's your pain? All that. But it wasn't limited to that. It was like, how's your life going? Like, how, and also stuff like, how is this injury impacting your life? Is your quality of life decreased because you can't extend your leg fully, type thing? You know what I mean? Um, and it was just really good to have that outlet and be able to like talk to somebody about it, be able to talk to somebody about the injury that I know both of them had a lot of experience dealing with ACLs. So like being able to ask them questions and kind of have peace of mind based on their answers, that was pretty big for me. And then the last piece I'll add about just athletic training in general is like sometimes an athletic trainer is around you just as much as anyone else on the team, but there's still kind of that separation. Like this is a different field than the coaches and the players. So it can even be like a venting type situation. Like if a player wants to talk about something that happened at practice, but doesn't want to go to the coach and like complain, or doesn't want it to sound like an excuse, like an athletic trainer is there and isn't necessarily like doesn't necessarily care about who's playing in the game. It's more about just like making sure everyone is healthy enough to play in the game. So just like being there and being available to talk, I think is a big aspect as well.
Awesome. That's a really great description. And I know in injury, a lot of people feel isolated, I guess might be a good word for it, right? Or they feel like they're the only ones having to go through this. So it sounds like your athletic trainers having experienced this with other athletes before might have been reassuring in the recovery process.
Yeah, definitely, because I would ask questions like, I haven't been able to do this or this yet. Do you think like within a couple weeks? Like when do you think I'll be able to do it? And it's like, oh well, when I had this similar injury, which was also ACL, PCL, partial meniscus, this is how it went. And obviously, like I've said a couple of times while we've been talking, everyone's different, and like not everyone's timeline is gonna match up exactly, but um, for the most part, it will, right? So.
Okay, cool. Thanks. So then the next piece that I kind of want to talk about is prevention. Now, obviously, trying to not have injuries is probably the best way to, stay up on it. So can we talk a little bit about prehab? What's the difference between a prehab and rehab, if there is one, and how can that preventative care assist in the long run?
Yeah, I think that prehab, I'm a big advocate for prehab or injury prevention type activity for sure. So part of prehab literally is just like lifting weights and getting stronger is part of your prehab because if your muscles are strong, it's gonna be harder for your joints to do things that they're not supposed to. If that makes sense. So that is the like main way I feel like it happens. And even I've been in situations like with Michigan basketball where they do injury prevention as part of their workout. Like it's specifically called that, and they just do like some of the same exercises that I do with people that sprain their ankles, and they're doing it without any ankle sprains. Like they're just making sure that the small intrinsic muscles in their foot are working and like active and not about to just collapse when the first time they go like this a little bit. You know what I mean? Um, so yeah, and then also part of the prehab is like one thing that I had no clue about until I went through it with my ACL injury was like before surgery, there's even a prehab component of like, let's get you as strong as possible because you're going to have so much muscle atrophy from not being able to move around very much and not using your right leg. Let's just increase the strength of the right leg in this. I think I had like, I believe my surgery was a little like 4 to 5 weeks after I tore my ACL. So I was actually already walking by the time I got into surgery. And I was doing a lot of prehab in terms of like strengthening my quad, my hamstrings, and my calves, because they told me once you're not walking on it for a month, all that's gonna shrink. So let's just get it big so that it shrinks back to like what it is now instead of like just becoming way smaller than your other leg. Then you're gonna have this imbalance.
I've
And
heard something
it's crazy
similar with people
because
that are going to have surgery for like replacements and stuff too, right? Like
Mhm.
trying to make sure that they can recover better almost from
Yeah,
the surgery.
yeah, definitely.
And go ahead. What were you going to say?
I was just saying it's kind of crazy because like even to this day, like I don't work out super often, but I work out I guess enough for me. And my right lower half is like still noticeably less muscular than my left, even though I tore my ACL in 2017. And I worked for a long time after 2017 to like specifically strengthen my right. And the past few years, I haven't focused specifically on that as much, but like you would think that as I kept getting stronger, that it would kind of balance out eventually, and that really has not been the case.
What do you think the limitation is there?
I think part of it is still like a mental or like confidence piece. I was actually talking to um, one of my athletes that tore their ACL within the past 7 months or so, and that's like the main thing they're going through right now. They're like, my my knee's okay. Like we do rehab 3 times a week, and like we talk about things. We do hard things that are kind of sport specific. Like I know that my knee can take it, but it's still this whole mental thing of like, ooh, let me not put the my body weight on this foot during this like pause. You know what I mean? Even like Like simple things like when I'm standing on a bus, I tend to lean more on my left side just because. And it's not even like, oh, I don't think my right side could hold up. It's just like those 6-ish months where my right leg was just like out. Um, I was doing everything with my left, so it's like,
So it's almost subconscious now, right? At
yeah,
that point?
yeah.
Yeah.
Mhm.
Okay. So then, for people that are trying to maybe recover from an injury, recover from a surgery, how can they, and maybe this is a little bit more, of the fitness side, but how can they try to kind of even things up a little bit more?
Yeah, I think you can't do what I do. You gotta just like go hard on that joint or body part or like extremity, and you gotta just focus on that for a while. Um, and maybe just kind of keep maintenance. So like in my instance, maybe it would have looked more like I'm doing a lot of single leg activity on my right, and then with my left, I'm kind of just doing like high repetition, high volume, or not as high volume, just high repetition to like keep my muscles tone and endurance there, but not necessarily bulk up as much.
Okay. And I'm bringing this up because I've heard both. So let me know what you think. That you, because obviously there is some cross work that happens in the body, right? So if you have an injury on one side,
Mhm.
usually physical therapists will suggest that you're still lifting with the other side because it'll
Yeah.
work its way across, however that works, right? So when it comes to that and, trying to strengthen up one side rather than the other, I've also heard that it's important to try and be as even as possible on both sides. So if
Mm.
you're doing single work on one side, you should do single work on the other side, even though that the first side might be weaker and might
Right,
need more
right.
attention. But it'll almost also sounds like doing additional work for that injured ligament one, or ligament, excuse
Yeah,
me, appendage.
I would say that either doing additional work or like you're saying, do everything the same on both, but maybe um if you're doing like if it's a shoulder thing and you're doing dumbbell shrugs or like those push-ups where you're like pulling the weight too, maybe you're doing 20 on your right and you're doing 15 on your left type thing. Like even small things like that, I feel like could help. But I if my athlete wanted to do it on both sides with the same weight, like I wouldn't be like, no, you can't do that type thing. They could do what they want to do and it, it'll work out eventually. Like
Definitely. Okay, cool. Awesome. So I think that's the biggest questions that I had about just injuries and being an athletic trainer. So can we just talk really briefly about the athletic training field? So what are some other professional possibilities besides working for a school that an athletic trainer can do?
yeah, so I'll say for one, like obviously with the schools, I feel like college and high school are the biggest part with those for athletic trainers. But there's also athletic trainers at more specialized schools, like vocational schools or even like dance schools. I had a friend of mine from undergrad that worked at a dance academy, and she was an athletic trainer there, which is like something that I don't think would immediately be associated with athletic training, but that's definitely a field or part of this field as well. There's also industrial setting athletic training. So like big companies. The one that I'm thinking of right now is Boeing, I think it's called, and like there's warehouses there where people are, lifting boxes up all the time and like putting a lot of stress on their back. There's athletic trainers specific for that workplace there. You know what I mean? In that industrial setting. There's also hospital athletic trainers that are there for partially emergency response and partially for immediate rehab following like a surgery or anything like that. Um, then there's also athletic trainers like in the military too, that if somebody sustains an injury from whatever they might be doing, the athletic trainer is there to do a lot of the same things that we do here at school, which is prehab, pain modulation, rehab, all that.
Okay. And it sounds like with all those different settings, there are probably also other medical professionals that you work with. What are
Mhm.
some of those other professionals that kind of tie in and play with athletic trainers a little bit more?
Yeah, I would say there's definitely a big group that all factor into the sports medicine field. I think it starts with the athletes themselves, and then everyone kind of is a support around them, including the athletic trainer, usually including some sort of team or at least like school-wide physicians. Like here at NMSU, we have two physicians that are local to Cruces, and they like serve the NMSU student athletes. Um, then besides physicians and athletic trainers, there's also like if you go on an ER visit, like there's going to be a nurse or a nurse practitioner that is taking you in, so that could be part of it too. There's the EMTs and emergency responders that are on the sidelines at football games that when they see an athletic trainer wave them on, like they have to be ready to come on, bring the whole shindig, all that. Um, what else? We also strength and conditioning, while it may not be initially like seen as like a medical uh part, I guess, of the support system, but like I would argue it is. Like we talked about before, like the strength buildup is a big aspect of rehab and prehab. So I would say that they're part of that system as well. And then there's also uh sometimes there are schools that have sports specific psychologists or counselors that are part of that like mental aspect a little more, and like if a situation presented itself that's a little um not within an athletic trainer's like scope of practice, I guess, or kind of something more serious than that, they would want a trained professional to help them with more than like just get advice from an athletic trainer or a friend, then that's something an athletic trainer would kind of like help guide them to get to whoever they need to talk to. So those are some that come to mind immediately. I'm sure there are more. There's like uh, if a school has a lot of resources and like they might have someone specific for dentist, someone specific for eye injury, someone specific for like upper extremity joint injury, someone specific for orthopedic, yada yada. Like it could go on a very extensive list, but I would say the ones I just listed are more like the core pieces,
Very
the
cool.
ones that are involved in most athletic training and sports medicine scenarios.
Awesome. All right, cool. So then, for people that might be interested in a similar career or in being an athletic trainer, can you tell us about some of your favorite parts of being a trainer?
Yeah, so part of it is just like being there for the sport. Like I said before, basketball is a sport that I enjoy watching, and like even if I wasn't getting paid to, like I would be at every game that the team plays, you know what I mean? Um, and baseball, even though I don't like watch it as much as football, I've grown to even like it more through this, just like watching them do drills and stuff. So part of it is that like entertainment aspect that I enjoy, and just like my job being around sports is fun to me just because I like competition and I like sports, so I like to see it play out, and just being able to be that close to it is pretty cool. But I would say for sure my favorite parts would be watching progression happen in front of your eyes, like with especially with acute injuries, it factors in a lot. Um, so it would be like for an ACL, I even me experiencing my progression, it was really rewarding. But then when I first helped somebody rehab from an ACL, it was like, wow, like this is dope. Like this is why I did this. Like I'm finally giving back and like helping someone else come back from what I went through. So that's probably my favorite part. And then just like interacting with other athletes, coaches, people that also care about the sport, whatever sport it might be to a certain extent, and just like those interactions.
Awesome. And then, with the good comes the bad. So, just to make sure people are prepared as well, what are some of the difficult parts about being an athletic trainer?
Um, I would say some of the difficult parts is hmm, time. Like depending on what setting you're in, you might be asked to put in a lot of time, especially during your respective season. You're kind of expected to always be available, like kind of always be on call type thing. And that could be pretty difficult in terms of like a work life balance. So trying to maintain and like establish that work-life balance is really, really important and can sometimes be hard for sure. I would say specifically as a graduate assistant, it's really hard sometimes to be with cheer and baseball for throughout the day, like a collective like 7 hours, then come home in the evening, have to eat dinner and shower still, and like have homework to do. Um, but that's a little more specific, like I said, to being a GA, being a student athletic trainer. Um, and then I would also say sometimes while my part of my favorites is like those interactions with athletes and coaches, like when you have a big team, there's gonna be some differences in opinion, differences in thoughts. So it can be difficult to interact with people that you might have disagreements with or might not see eye to eye with, or even maybe one of the harder parts too can be putting your athlete's health is like our main priority, right? As athletic trainers, but a coach's main priority is like they might be more in like a I need a win type thing. So like don't take this athlete away from me and then you get into some sort of disagreement about that too. So that can be a little tough to navigate. But I think with experience, just like with everything, experience is the best help for that and communication.
Awesome, thank you. So then, if somebody wanted to know a little bit more just generally about athletic training, what would be some resources that you might point them toward?
Yeah. So if just to know a little more about the profession, especially in the United States, at least, the National Athletic Trainers Association, that's like the big overarching, uh, biggest org, excuse me, that I can think of. And on their website, they have like different career settings that you can be involved in as an athletic trainer. They have like the history of athletic training briefly listed on there and like how it went from this really obscure thing in the 60s and 70s to like now it's very established and like officially I think not too long ago it was like officially recognized as an allied health profession. Um so so yeah. That the NADA stuff would be the biggest thing, but honestly like I think just looking up athletic training, like there's probably a lot more resources than just that. Like probably just putting it into Google and saying athletic training settings, athletic training fields, or even athletic training programs like school programs. You can learn a lot through there too.
And to clarify, a couple years ago, you could be an athletic trainer with a bachelor's, but it's turned into a master's program. Is that correct?
Yeah, so this class that's graduating in April and May of this year will be the final bachelor's in athletic training class amongst the whole nation. Um, and from now on, it will become either you're an entry level, so like for the most people, I guess it'll be like you finish high school, come into college, and you're in a 5-year program that is 3 years undergrad, 2 years masters, or it'll also be like which is the one I'm about to explain is what NMSU is actually incorporating next year. It'll be more like you graduated from undergrad in whatever your degree is. More than likely, it's some sort of kinesiology or exercise science or uh, sports medicine type degree. And then you come into an athletic training master's program that's 2 years long. So, yeah, so basically, most athletic trainers will have some sort of master's degree. Every athletic trainer that comes after this year will have some sort of master's degree.
Okay, awesome. So, my last couple of questions is what's next for you? Where are you headed?
So I am like this program I'm in at MSU is a 2-year program, and I'm in my first year of that. So I'm still here until whenever baseball season ends in 2024. And from there, I don't know where I'm headed. I have thought about like any specific places I want to go, and it's not like I have any in mind. When I was leaving Michigan, I really wanted to go. One of my biggest things was going somewhere warm, because I lived in Chicago and Michigan my whole life. So I wanted to go somewhere different, somewhere I hadn't experienced like the actual environment as much. Now that I have been here, I've definitely enjoyed the warmth and appreciate it, but it's not necessarily something that I prioritize enough to like will be like I need to go somewhere warm for my next job setting. It's kind of just like up in the air, and I'll kind of see where I'm able to go, and hopefully eventually it's with basketball like I want to be. Um, but eventually I also want to end up back in Chicago. I just want to go to a few more places first and just like experience life before I settle back down.
Cool. All right. And then if anyone has any questions for you, wants to get a hold of you, what's the best way for them to do that?
Probably just email me at my NMSU email that's listed on the NMSU Sports Medicine's staff um, website, or I think I might be listed on the baseball roster one too. I'm actually not sure. But yeah, probably through there would be the best way.
Okay, great. Well, thank you so much. Do you have anything else to add before we go?
No, just thank you very much for allowing me to do this. This is really cool. I'm glad that I got to talk about athletic training as a profession, as a field, and to kind of give you a little more background on me specifically, why I'm doing this. So yeah, thank you, Michelle.
Awesome. Thanks for being here. I'll talk to you soon.
All right, talk to you soon. Bye bye.